Hello, juniors. I know that you're about to embark on an interesting transition this semester, not only to caring for patients individually, but now moving forward to caring for patients, families, and communities, and often patients who have a lot of difficulty in finding ways to care for themselves, and who desperately need nursing to be caring personnel that can guide and help and collaborate with them. I'm going to take you through a little bit of information about caring in general, thinking about how do I really demonstrate caring in my nursing practice, and ways that you can get involved in showing caring in general with multiple patient populations. There is a lot of literature, believe it or not, about caring science. And all this means is that for several years, nursing scientists have really studied this involvement of how humans connect with different contexts in terms of their life and death and health and suffering. And what is it that is optimal that people can do from a variety of disciplines to help that human condition, or that's effective in that human condition. So there's actually a growing body of knowledge that has been developed through multiple studies looking at what all's going on in that interrelational interaction that's going on. And it's good for nursing students to get a little bit of insight to that, because maybe you're somebody who caring with people and engaging with people comes naturally, and sometimes that's just something that people have to learn and cultivate through their nursing practice because it's not something that comes natural to them. When we think about caring as a concept, like a term or an idea, caring is essential and is really at the core of nursing. It requires at least two people, where one takes care of the other who's having some type of need for care or is having some suffering of some sort. Caring involves concrete action that can be learned and trained through practice. So again, a reason to bring this information forward to you so that you'll have the best understanding of what all is going on and what you need to know to do differently in these situations. Moral in caring means to see and confirm the other in the light of his or her situation. So we want to not just care, but we want to care morally, meaning that we're not just pitying people or looking at them through our own lens of our own existence, but to really try to make a concerted effort to really get in detail and understand that client's actual situation and their perceptions about life and health and well-being. So why do students go into nursing? For many, many years, if you went way back in history in the beginning of nursing, people thought of nurses as angels that were white, and they had a calling almost from a religious standpoint, much like a minister or a priest did, to go into nursing practice. They were long-suffering. They meant to totally serve, with no wherewithal of anything like a career or anything. It was all about helping people and having that gift of caring came about as part of that calling. But many of you may have not woke up one day and thought, I'm a caregiver. I love caring for people and animals and children and all different kinds of ways of caring. And so I feel like I've been called to be a nurse. More and more likely, many people have begun to see nursing as a very prominent and safe and secure financially career that has multiple venues of opportunities, different layers of education, different venues for working in all kinds of settings. And so it offers so much flexibility, financial stability, uh, maybe even people who are more scientific in nature who gravitate to this field that in years past would never have ever entered this profession. So, does everybody come with a calling and this capability to, engage and interrelate with their patients? That might not be what they come first with. They may come with a strong mind and a lot of good reasoning skills and a lot of scientific knowledge and background, and they're not really thinking about it as a venue for caring. So that doesn't mean that they don't get to care about people and just go on and become a nurse. Caring is essential to nursing. So it has to be part of a piece that's learned if someone is not coming to it with some skills along those lines. Caring requires nurses who focus on the relationship with a human being by seeing, understanding, and taking responsibility. So we have to be great seers of people. We have to seek to understand their needs, their backgrounds, their connections, their support systems. And we have to take responsibility for the actions that our career meant for us to be there to assist with. So why care? People in chaos are positively influenced by caring. You know, its energy facilitates change to foster healing or well-being from disease, from dis-ease or discomfort, need, pain, or crisis. So the reason we provide caring environments and caring interactions is to help people move to a better state of being as a result of our nursing practice. I wanted to not get into everything about theoretical models, but Swanson's theory of caring is a really nice, easy to understand way of thinking about about caring. And Kristen Swanson is a theorist that lived here in North Carolina for quite some years. I'm not sure if she's still located here, but more out towards the east, and worked out of one of the universities in the east part of Carolina. But she's been very personable. I actually did, when I was doing my master's program, I actually did a paper on Swanson's theory of caring, and I called her up thinking, she'll probably never talk to me. And she literally sat and talked with me for 15-20 minutes on the phone, all about her theory, and was just very engaging and exciting, to explain it all to a student so that I could make that come alive for students in nursing in the future. So I really appreciate her and her work. In terms of the way caring is thought about in her theoretical model, the first step is knowing. We have to really know the patient. Many of us get reports on patients when we come to work or take a case out in the field, go out to the home, or go to a facility and get report from another nurse or caregiver or physician. And it's 9 times out of 10 got tons of errors in it. And so we're starting off on every shift thinking, do I really know this patient? I've got data, I've got information. How correct is it? And I can tell you, if you go in and talk with your patients when you're doing an assessment and just ask them, tell me your story. Something very simple like that. If they're capable and they're feeling like it, and if they're not, sometimes they'll have a family or a caregiver, and you can ask them, tell me how y'all came to be here. I'd just like to hear it from your viewpoint. You will learn 100 things more about your patient than it was ever on a report sheet. The whole picture will come together for you so much more. So that I'll give you just that as one way to really know your patient. It's important to know their relationships. As many of us know, not every family dynamic is that easy to talk about. Might not be positive. There can be great supporters of people, and then there can be folks that are engaged in their life that are toxic to them, and they may or may not be able to really discuss a whole lot about that sometimes, particularly when there's family there. So I often ask patients about their relationships when there's people there and when there's not people there. And you get a much richer understanding of the connections of what's supporting them and what's not. We also want to know what are their goals and attitudes and values and beliefs. And are we really grasping their wholeness, everything about them? Do we understand sort of their history, their background, how they came to be in this situation that they find themselves in? And sometimes just life review of some of that helps them have a better connection and understanding of the process of things as well. I would also mention that we have biases that about knowing another human being all the time. There are people that, we discriminate against without even really realizing it. We go to turn and lift a very obese patient, and we struggle, or we have some kind of no, do it this way, and we're acting rushed and we're acting a certain way because of that, or any other human characteristic that may be different than our background, our own privileges. And so it's very, very important to really reflect before any caregiving is given on what are my biases and how is it that might prevent me from really opening up and knowing another human being. Would I be open to talking to a person who has a lifestyle that is against my religious beliefs, for example? How do I get past that if that's an issue for me? So be thinking about how you want to model your nursing practice in a way that, you don't go to the bedside to preach to people. You go to the bedside to engage with them and learn their story. And the more that you have that persona, you will get very good at knowing your patient. Another term that deals with knowing is empathy. And that is really about identifying with and understanding their own situation, feelings, and motives. And so, again, not putting our values and our ideas on it, but really understanding it from their perspective, and them feeling that they've been heard and understood really conveys a sense of empathy. I'm going to play you this little short clip of a video that's really a good thing in terms of creating a mental shift in your being with behaviors and actions, which is the next thing that we're going to talk a little bit about, is how do we be with the patient. But I wanted to play this first so that you could just hear this brief clip and see how it influences your thoughts.
Here's a paradigm shift. I was on a subway in New York. One man came in with a bunch of little kids, and they were wild. I thought for sure that they would settle down after 2 or 3 minutes on the subway, but they were running up and down and climbing around and really upsetting and disturbing people. I was just observing this whole scene, and this continued on so much it became irritating to people. And I started to feel some irritation, and the father just kind of sat there, kind of looking around. His head was down a lot of the time. I was kind of annoyed, and I went up to him and I said, "Sir, you know, your children are so upsetting to so many people. Don't you think you can control them a little better than this?" And he said, "Oh, I know. We've just come from the hospital and they've just lost their mother and they don't know quite how to handle it, I guess, and I don't either. I mean, so hard, see." Now, imagine you're in that situation. Would you have a paradigm shift? In fact, didn't you just have it just now? You see him totally differently, don't you? Now, what if I'd really tried to just change my behavior a little? Not speak with, say, irritation in my voice, or have a little better attitude toward him, see? Or just smile about it, but no effort to see it from another frame of reference, see? You can see how I can make a little improvement in the situation. But when a fundamental shift took place in the way I saw that situation, then I immediately wanted to help him. Let me help with the children. Let me entertain them or play with them. I'm so sorry about the loss of their mother and your wife. It just so, can you tell me a little about it, see? In other words, it spontaneously, it sincerely came out of me. New behavior, new attitudes. You don't consciously work on behavior and attitudes. What you do is work on your paradigm. Then the behavior and the attitude will automatically begin to change. Now, paradigm is a word that comes from the Greek word paradigma. It means pattern, how you see reality. Here's the paradigm.
So, moving forward, the next area in Swanson's theory talks about being with. And of course, we all think we are with patients, correct? But are you really having an intimate caregiving relationship that is characterized by expert nursing practice? Obviously, students, you're not expert nurses now. However, you should be expert nursing students, and the more you go through the program, you'll gain more and more confidence. But are you really being authentically present with another person to really convey that their experiences are important to you? Are you doing 100 other things? Are you not looking at them face to face? Are you typing things in the computer and really looking at the computer screen and not really being present with them in a way that they feel your presence there with them? You know, being with people, includes being with them, non-burdening them with things that's going on with you. You don't stand and talk with patients and talk about the rough day you're having, or we're short-staffed, or you're there to convey your availability, that you're going to be with them through the whole day, the whole session, whatever the case is, that you're really going to be present and with them, and the ability to share feelings with them. a long time ago, people used to say, oh, you have to have this professional comportment and you should never share your own feelings about things. You shouldn't show emotion. You should just be, the authoritarian nurse that's very in control. And that is absolutely not effective with helping patients and caring for them adequately. There needs to be, in this being with people, connecting, bonding, and attachment. And in other words, enacting what we call nursing presence. And nursing presence is something that I have studied and continue to work on studying in terms of one part of caring science. So I'm going to talk to you just briefly a little bit about that so that you understand what is it to be able to be capable at presencing with patients. Hopefully you can look at this when you have more time because there's a lot of words on this page. But this is really a great model that shows you what all's actually going on in that, client and nurse interaction. If you look at it, the nurse has knowledge. She has professional maturity, moral maturity, relational maturity, meaning she can relate to patients well, and she has personal maturity. And by engaging with the patient, because of those capabilities, they're able to recognize needs in patients, or patterns, and they're open to the patient. And then based on what they assess and the cues that they really receive in terms of what all they're recognizing in the patient and collaboratively working with the patient on, they determine, is this person ready for me to really engage and be present with them? The nurse takes a pause and tries to determine what is the right way to engage with the client in a professional way that's going to be effective. And they kind of just decide and innately know this is the kind of thing. Maybe this is the time for some humor, maybe this is the time for us to allow for some active listening. But in whatever way they presence with that patient, they are deciding what is the method of engagement or the dose and how they deliver that dose of presencing with that patient. And as you can look at the client side, the client has got to have physical needs, psychosocial needs, or spiritual needs. They have to have a degree of openness to allow a presence with the nurse. All of us may have been in and looked at a patient and tried to, develop some rapport or closeness, and the patient's just not open to it. So and many times the compatibility can be affected by things like age, gender, cultural differences, spirituality, or maybe they've had poor nurse-client relationship situations in the past, and so those can influence it. But if this dose is delivered, it's done appropriately. It can be done by holding somebody's hand. It can be doing a physical activity with somebody. It can be something that's done via phone or e-presence or in person. And the whole goal with that interaction is to engage, and then did it meet the desired client outcomes? So just kind of thinking about this whole dynamic is sometimes good just to kind of look at what's really happening in the behind the scenes thing that actually is going on when you go in the room to engage with the patient. Doing for is the next category of Swanson's theory. And doing for requires professional confidence, knowledge, professional and technical skills, a lot of self-confidence. You have to have a professional presentation. Sometimes as a new nurse graduate and as nursing students, it's harder to, you can almost be more caring in if you're good at that already with a client. It's the doing for where you're trying to detect, investigate, prevent, listen, anticipate their needs, educate, kind of advocate for them, monitor them, um, being sort of an expert at therapeutic interventions of all types, and then really providing individualized, holistic care that really meets that individual's needs. And so, this is the part where a lot of times people will sit, the people who really good knowledge people in the career, they'll do real good in this part, but maybe not as good in the being with category. And then there may be people who are great caregivers that are doing great things in knowing the patient, being with the patient, but they're kind of struggling with their time management, or knowing what they need to know sometimes and have to look it up, and so maybe they don't come across as with as much professional confidence. But that is part of it in terms of caring too. So you want to take the time and learn everything you can and try to get the best grades and things that you can in terms of the technical side and the professional knowledge and decision making, just because that is what helps patients want to interact with you and believe and trust you that you can really do these things for them adequately and with expert care. The next category is enabling. Patients, your goal is not only to just do for somebody, but as time goes along, enable with them, meaning that the patient becomes the collaborative partner. You want to have a lot of assessment of together with you and the person. Um, what is their knowledge, their self-management skills, um, encouraging self-care based on what the patient's motivational level is at different times. Um, enabling, encourage, you have to have, excellence in patient and family communication. And by that, regular communication, clear communication, accurate communication, doing it honestly and empathetically. And so enabling is part of a partnership type mode of being. Um, and this is where active consideration of family dynamics, cultural and religious beliefs, and previous experience with loss, their experience with illness in the past. And then enabling also is about how to, with your partner patient, look at how are we going to measure if we've made success and met some goals and outcomes and things. So having some discussion about that to see how are we moving towards some positive improvements with the client's health and well-being. And the last category is maintaining belief. Swanson's viewpoint theory deals with a humanistic and holistic view of the person, respecting individual differences and treating people as unique persons, again, accepts other people as they are, and understanding the need for the maintenance of a harmonious balance between body, mind, and spirit, and involving assisting patients to have their own spiritual beliefs and their connections with a superior being or whatever their religious ideology may be, and supporting that along with them so that nurturing that may help them, emotionally handle their illness and other things. So it has a very important thing that if you're not accepting of those kind of conversations with patients about those kinds of things, you can be a caregiver, but you might not be a full caregiver unless you can be open to those kind of interactions as well. I'm going to try to play you a short video clip here that's about 5 or 6 minutes, and that will probably take up the last part of this training piece, as I'm trying to keep it to around 30 minutes, and then I'll stop it. I'm going to provide you this PowerPoint in a separate section, because following this, there is a really, really nice additional video that I would like for you to, when you get some time, listen to it and just see what kind. It's a little bit long for this, but I think it's a good thing to try to center yourselves as in the course in terms of community and mental health. You know, what kinds of people and experiences and caregiving things might I get into in a global health sense through my career. And I think that one will be, because it's longer, it doesn't have a lot of discussion. It's a lot of music and a lot of pictures and a lot of quotes and things that might be reflective for you to listen to about this subject of caring. And I'm going to just show you. This is the one I'm talking about to listen on your own. It's called A World of Caring. But the one I want to play for you in the time that we have left for recording is one that is a wonderful example of caring for community that really embraces knowing, being with, doing for, enabling, and maintaining belief. And it's called The Heart of Nurses. And it takes place in Memphis, Tennessee, which is not too far from us. But I think it shows how in being with the community, how you really can care for individuals, but as a whole, put yourself in situations, in venues, and projects in the workplace down the line, as students or as practicing nurses, that really helps you to care individually as well as broadly.
Megan, I think one of the big things are barriers.
Okay.
We've had several patients that have issues with housing. Some of them have been placed. Some of them have some donations, but a lot don't.
What kind of donations are we having trouble getting?
My name is Megan Williams. Before nursing, I was in finance. I became a nurse because I like to help people. I like to figure out what is important to people and be able to help them solve problems. Within our health system, we have our hospital system that treats a lot of uninsured patients. Some of these patients have no primary care physician, so they'll come to the ER to get their basic blood pressure meds. Some of our patients are homeless. Regional 1 had formulated that there was a problem with the high utilizers of the uninsured population. When we first started this project, our top 25 patients used the emergency room in 1 year on an average of 200 to 30 times. So a small population of people carry the majority of costs for the overall cost of care. The complex care program is around 4 years old. With the intervention of the complex care team, the nurses work with a social worker and start to look at and develop community plans of care and things within the community that we can help them with, which will eventually get to the root of the why they're coming and help to decrease those utilization, get them into appropriate care.
Hey, this is Ashley at Regional 1. How are you? I was just calling to let you know I set your ride up for today. When you come in, I got a pair of shoes for you in the clothes closet. I'm just looking now. Looks like your car is on the way. I'll see you once you get in.
In the city of Memphis, the poverty rate is 22%, and the national average in the United States is 12%. The poverty rate is so much higher here in Memphis, and many of the people struggle to pay their rent, struggle to find food and or basic needs of their life.
Growing up here in Memphis, it was really pretty rough. You know, as a kid, my dad held down 2 jobs. He inspired me a lot. You know, he made a man out of me early. When I was age of 5, we had to take on a paper route, help out with, you know, the bills and, you know, but as I grew up and got out on my own, I started doing sprinkler work, and I did it for 28 years until my legs started bothering me. I couldn't walk. I have to work. I have a family.
With Mr. Robert, his story was very similar to a lot of people, where he worked the trade job and he worked for a long time, and unfortunately his health declined, so it kind of led him into a situation where he could no longer work, but the bills were still coming in, had no insurance coverage, he had no transportation to his appointments. I had a lot of empathy for him because his story was similar to a lot of people that I know.
2020, my whole body just went paralyzed, and I fell out on my face. I had to lay off work for a few months, and the doctor came and told me, said, "You're not going home. You need emergency surgery now." Going through those surgeries, I lost everything. I had too much pride to ask for help.
One of our social workers works as a housing specialist. So once a week, she partners with an agency on the city level to look at patients that need housing, that are homeless. We also have MIFA, which is our Meals on Wheels program. They deliver fresh, frozen, or hot meals to our patient.
When I met Ashley, I was in the rehab, part of the hospital.
How does it feel to be back in this room? Does it bring back any feelings when I met you?
Oh, it brings back a lot of memories because I was about to give up, and you walked in the room. That really changed my life because I was like, I want to know what to do if I hadn't met you.
We were able to provide him and partner with a transportation provider, help him get his medications through our pharmacy program.
They provided me with clothes, shoes, and especially a warm coat. I really needed one. I was so excited when they called me to tell me that my disability was started and my insurance was started.
Being uninsured or underinsured, especially when you're sitting in a hospital bed and you don't know what's next, it's not about me and it's not about my team. It's really what we can provide for our patients.
You guys changed people's lives. This program is amazing. A lot of people around here in Memphis are going through the things that I went through. Regional 1, this team, I look at, they went out of their way to help me. I wouldn't change it for nothing in the world.
Oftentimes, we are the patient's main support role, and we're always here for them. We treat them, we meet them where they're at, and we build on those relationships.
I think the biggest thing about my job is that I don't see my patients as patients. That is my neighbor. That's my grandparents' friends. I grew up in this area. I take pride in that, I do. To do what we do and to make an impact, it's truly amazing, you know. It really is.
Thank you guys for listening to this presentation. I hope you find it valuable. There are lots of other resources out there that can help you be a great care provider and have a caring interprofessional and professional method of working with your clients and patients and families. And so I would encourage you to try these kinds of things. Think broadly about caring in the community as you go through your community health course, and look for things where you can be a star just like these folks are.